So I'm going to talk a little bit about South Africa and the Motor Neuron Disease Association there, and how I came about doing a project with South Africa. So I'm a professor in social work at the University of Wisconsin in Milwaukee, and my research area is on neurological disorders and the role that children play as primary caregivers. I have about 17 years of clinical practice, primarily in Huntington's disease and ALS. So this is an area that is very near and dear to my heart. I also do study abroad programs at my university, so that's how I got to South Africa. And a couple of years ago, met with the Motor Neuron Disease Association down there and talked to them about the work that I've been doing here in the US and the national study that I'm a PI on, looking at the role that children play as primary caregivers in families with ALS. And having discussions with them, asked them what they're doing with families and caregivers, got a lot of not much. So we decided to do a very brief pilot project to see what's going on in some of the families in South Africa and what are the best ways to provide assistance program supports, kind of develop a needs assessment. So this slide right here just gives you a sense of the enormity of South Africa. Approximately 55 million, and I say that approximately very clearly. There are large numbers of individuals coming in from the rest of Africa on a daily basis, so the population estimates wildly. It is 20 years post-apartheid, but the reason why I put that up there is that the healthcare system is taxed beyond all imagination. One of the hospitals that we visited is the third largest hospital in the world, and it's in Johannesburg, which is a city of approximately 5 million people. So the opportunity to provide care on a larger scale is very difficult, to say the least. There's one dedicated ALS clinic in the country, and it's in Cape Town. And Dr. Francois Henning, who was a collaborator with me on this project and who will be here later on in the week, is just extraordinary in the work that he does there in Cape Town. We were also very fortunate to collaborate with a neurologist in Johannesburg who doesn't have a designated clinic, but does see quite a few patients with, and excuse me, I use ALS and motor neuron interchangeably, who does see quite a few of those patients. What we do know is what we don't know is how many patients in South Africa have motor neuron. Wild estimates, but there has really been no number taken, mostly because the large influx of individuals. So that means that there's really no family or care assessments being done. What's going on in these families? What are some of their needs? But what we do know is that families provide near total care. So very brief slides. So this is my research area, young carers, and these are children under the age of 20 who are primary caregivers. And one of the reasons why it was interesting to be able to do this in South Africa is the enormous number of individuals affected by HIV and AIDS. And there has been a fair amount of work in South Africa looking at these children from the kind of point of view of them being a child-headed household. So these children are taking care of siblings and patients and whatnot. But outside of HIV and AIDS, we have no information about what's going on in families, particularly in complex neurological disorders like ALS. We do know that kids are affected in school, they're emotional affected, their peers, depression, and most importantly, a lack of social support. Other kids who are not caregivers really have no understanding of what it is to bathe, toilet, and feed a parent. So the U.S. Young Carer Project that I'm a PI on is funded by the ALS Association here in the, well, wait, where am I? No, not here. Wherever I normally am, in the United States. Sorry about that. Jet lag. So we currently have 96, this is actually wrong, we have about 104 families who are participating in the study. And one of the things that the South African Association was very interested in are, you know, what are some of the similarities and differences in families in South Africa versus the US using some of the data that I've already collected. So I just put these up here because I think it's always powerful to put the words of our patients and our participants. And this is a young girl who says, I like helping her before she dies. I do a lot and it's hard, but I get to spend time with her, so it's okay. She's getting worse, but I know I'll have to do more, which scares me. but I'll do it. So if you can think about putting yourself in the mind of a child who's trying to care for a parent, and then in the context of South Africa, where there are very few, if any, supports or services available. So it was a cross-country project, and we were very fortunate to be funded by a collaboration project through the Alliance, where both myself and I took 3 of my undergraduate students with me, they were thrilled, to be able to go and meet with the association in South Africa, meet with their care providers, meet with some neurologists, and we were able to visit with, in their homes, 20 families in both the Cape Town and the Johannesburg area. And some of these homes took us an hour or 2 to find. A lot of the homes don't have addresses, don't have actual roads. It was very much dirt road, pebbles to get to. So it was an extraordinary experience, and one of the physicians went with us, and he said that was the first time that he had ever been to a patient's home in his 20 years of practicing neurology at Baragwanath Hospital in Johannesburg. So these are some pictures of some of the extraordinary people. Down at the bottom is, does it have a pointer? There's Dr. Mohan. This is the doctor's area at the Baragwanath Hospital. And right there is Dr. Henning, and this is at a dinner we had with a couple of the care providers. And Stellenbosch University, I neglected to take a picture, but we did a presentation at the School of Social Work there, engaging their students around working with families in ALS. So the family meetings, we met with 20 families and their youth. The children ranged from 8 to 18. The interviews lasted for about 45 minutes. We met in a couple of clinics, both at Baragwanath and at the clinic there at Dr. Henning in Cape Town. A little bit of breakdown. This is the researchy nerd in me, so apologize for all the numbers. But just to give a sense of, one thing we do know is that the patients that we met, now granted this is only 20 out of an N of we do not know in South Africa, overwhelmingly they were younger, they had a lower socioeconomic status, and were overwhelmingly less educated than any of the patients in our study that we're doing here, there in the US. Yeah. So relying on public care, 70%. So the healthcare system, as I said, is extremely taxed in South Africa. They have medical aid, which is the US equivalent of Medicaid, which is, you know, public care in other countries. Out of the 20 families, only 9 were currently accessing any services through the Motor Neuron Disease Association, and only 1 of those 9 was in the Johannesburg area. So remember, Johannesburg has a population of roughly 5 million people. At that time, they had 1 part-time care coordinator for the entirety of Johannesburg. So that leads us to understand why we don't have a really good grasp on what's going on in South Africa. And the majority of care that they did receive were calls from care coordinators who are just extraordinary women. Overwhelmingly, they had 3 in the Cape Town area and 1 in the KwaZulu-Natal area out near Durban. Access to care. It is incredibly difficult to get care. Public transportation doesn't exist unless you're in the city of Cape Town or in the very heart of Johannesburg. And the patients and families stated what they really needed were transportation, help to get to see a physician, any sort of equipment. We visited homes where families had no equipment whatsoever, not even a communication board, and just basic finances. These are individuals who are absolutely impoverished and dealing with something that I don't have a big slide on, which is quite frankly a conversation that'll last hours, is the issues of stigma and isolation and shame in a country that still has a tremendous amount of, for lack of a better word, magical thinking about how one gets motor neuron. They do have a strong belief in being cursed, and when you do have that, you don't go out in public and communicate that with people around you. The interviews that we did with the children, they ranged from 9 to 20. You can see that they're doing an extraordinary amount of care, including administering medications. This is counting pills, giving shots, being completely responsible for all medications of their parent. Compared to the US young caregivers, South African youth are more involved in hands-on daily care, and they use fewer assistive devices, predominantly because they don't have access to the assistive devices that US patients overwhelmingly do. So you'll see that 60% of the US population in our study are dealing with communication devices, only 22% in the South African study. So one of the things that we know is that these youth are really taxed, and they would benefit greatly from skills, knowledge, and support. They spend an average 24 hours a week providing care. The impact of culture and stigma, again, can't be highlighted enough. The majority of them do not talk about it with their friends at school because they're very concerned about the cultural implication of saying a parent has a debilitating illness. In a departure from the US study, most of those youth really wanted to access other youth by Facebook and Snapchat and things I don't know anything about. But the South African youth really wanted one-on-one personal interaction with other youth. And then this last question, which is something that is very near and dear to my heart and part of my research trajectory, is this issue of training. 65% of them had never been trained in anything that they were doing as a caregiver. Now remember, these are children who are involved in very, very, very hands-on care, bathing, feeding, toileting, medication, transferring, and had no idea. They were winging it, and it was very concerning and very scary to them, as well as it was to their family member. But everyone recognized that they needed more support and they needed more assistance, particularly around these active caregiving. And these are things that every single one of us in this room know, those of you who are doing extraordinary work running associations. How do you do that? And so that's a lot of the takeaway with the Motor Neuron Association. You know, thank you for coming and interviewing all of these families, which we could never have gotten to. Now what do we do? And so the next step conversation, I think I have a next step, there it is, looking at how do we spend, or how do they spend, the small amount of money that they do have on very targeted programs. What are the highest needs of these families? And one of the things that was expressed, even by the patients that we interviewed, kept saying, what about folks in the Eastern Cape, which is the KwaZulu-Natal area, where we had no access to? Millions and millions of people with no primary care. And the number of neurologists, one of the neurologists said there were 50 neurologists in the country of South Africa. 55 million people, 50 neurologists. Now, that was shocking to me. The clinic in Baragwanath in Johannesburg is already looking at ways to reach out and engage a lot of their families. Baragwanath is based in Soweto. So those of you who are familiar with the Soweto, that is where Nelson Mandela is from. So that is a massive township. And the Baragwanath Hospital has a lot of outreach there. And then Stellenbosch University is very interested in engaging their students in doing field sites and field work and clinical work with families around the country, not just in the Cape Town area where they're located. And this is a phenomenal quote that someone said to me that I had to put it in there because I think it really resonates when we talk about, oh, how do we do this? How do we provide care to our families? What do we do about these young carers? And what are the ways that we can engage? And knowledge is like a lion, and we can't embrace it gently. We have to just dive in. And it was very empowering to see the way that the clinic and the association in South Africa really is taking this information very seriously and trying to figure out best ways to engage the families they know of and figure out how to find out how many more families are out there. So very, very big thank you to the Alliance. I also received funding through my university and a private foundation, and the families can't thank them enough. So, thank you all. Oh, you're welcome. So many questions. Yeah. I have loads of data. So if anybody wants to just like sit and talk about specifics, we did collect a lot. So
overwhelmed.
They're overwhelmed, but they're tired. Food coma at lunch. I get it. Thank you all very much.
Thank you.